And welcome back. Again, we are hosting a question and answer vaccination phone bank right now. And joining me live is Dr. Dina Tom with University Health System, a pediatrician there. And a lot of people have many questions about, vaccines and going back to school. But also, a lot of people had submitted what are the vaccines that people have the most questions about?
Sure. So most people have questions each year about the flu vaccine and whether or not you can get the flu from the flu vaccine or if it's safe. And then also HPV, since that's one of our newer vaccines historically, even though it's been around for quite a while now and we know a lot about it.
And on that note, I know some people wanting to get their children up to date. How do they know that they're up to date on their child's vaccines? Where can they go?
That's a great question. So a good place to start is the pediatrician office, if you have a pediatrician's office or if you've been to a few, to request those records, because they keep good, usually they need to keep good records. And then also a lot of different states have a state reporting program that you can opt in or opt out of. And so that's a good place also to start to ask your pediatrician or even school nurse if they have access to the school reporting online, and they can log in and see if your child has been vaccinated at different sites and have a record of that.
And then, there's we were talking about school, and I think you mentioned a couple of the vaccinations already. There are some vaccines that people should consider even though they're not on the school list. Mm-hmm. Which ones would those be?
Yeah, so HPV is a big one, and the flu vaccine is huge. I mean, the flu takes out thousands of children every year out of school, puts children in the hospital, and then puts others at risk. And the flu can be pretty significant. I've taken care of plenty of children with pneumonia after having the flu. So those are things that the schools don't require, but will absolutely help keep your child from missing days of school, and then potentially with HPV from having cancer in the future.
Well, definitely
helpful.
It's
amazing.
Well, again, Dr. Dina Tom, thanks for joining us. And, of course, the phone bank is still going on live, so you can call that number on your screen, 351-1363. Back to you guys.
All right, Steph, thank you very much.